Anakinra, also known as Kineret Syringe, is used to treat rheumatoid arthritis by slowing joint damage and reducing joint pain and swelling. This helps improve movement. It can also be used to treat cryopyrin-associated periodic syndromes, CAPS, and neonatal-onset multisystem inflammatory disease, NOMID, improving symptoms such as fever, rash, joint pain, vomiting, and headache. Anakinra is also used to treat deficiency of interleukin-1 receptor antagonist, DIRA, a condition where the body does not produce the natural protein interleukin-1 receptor antagonist. It is a man-made form of a natural protein made by the body, which helps to block the effects of another protein that can cause symptoms such as joint pain, swelling, and stiffness. For coronavirus disease, COVID-19, the FDA has allowed the emergency use of Anakinra to treat hospitalized patients with pneumonia who also need supplemental oxygen. If Anakinra is used to treat COVID-19, more information about the drug is available from the patient information sheet provided by your healthcare professional. The daily dosage and optimal timing for taking Kineret Syringe should be determined by your doctor. Before you start using Kineret Syringe, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. If you are administering the injections yourself, a healthcare professional will train you on how to properly prepare and inject the medication. If anything is unclear, be sure to consult your healthcare professional. Kineret Syringe is injected under the skin as directed by your doctor, usually once a day. The dosage will depend on your medical condition, weight, and how you respond to the treatment. It's important not to shake the medication, and before using it, check visually for any particles or discoloration. If you see either, do not use the liquid. Let the medication come to room temperature for 30 minutes before injecting. Before each dose, clean the injection site with rubbing alcohol. It's important to change the location of the injection site daily to avoid any issues under the skin. Do not inject in an area that is tender, red, bruised, hard, or has scars or stretch marks. Use Kineret Syringe regularly to get the most benefit from it. Try to use it at the same time each day to help you remember. Do not reuse the syringe. Learn how to store and discard needles and medical supplies safely. Consult your pharmacist for more details. If your condition does not improve or worsens, be sure to inform your doctor. After taking Kineret Syringe, you may experience redness, bruising, swelling, and pain at the injection site, which are usually mild and may last 2 to 4 weeks. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Anakinra has caused very serious infections such as skin, bone, or joint infections, and pneumonia. Tell your doctor right away if you develop signs of an infection, including a sore throat that doesn't go away, fever/chills, cough with mucus, spreading redness/swelling/tenderness of the skin, or bone pain. While a very serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed above, make sure to contact your doctor or pharmacist. If you're in the US, call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before starting Anakinra, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Also, discuss your medical history with your doctor or pharmacist, especially if you have had infections in the past, immune system problems, kidney disease, or asthma. Anakinra may increase your risk of getting infections or worsen current infections, so it's important to avoid contact with anyone who has a contagious illness. If you have been exposed to an infection, talk to your doctor for more guidance. Before getting any immunizations or vaccinations, let your healthcare professional know that you are using Anakinra. It's also important to avoid contact with people who have recently received live vaccines. Older adults may be more susceptible to infections while taking this medication, so it's important to be extra cautious. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. And if you are breastfeeding, consult your doctor before continuing to breastfeed while using Anakinra. It's important to be aware of potential drug interactions with Kineret Syringe, as they may change how the medication works or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without your doctor's approval. Some products that may interact with Kineret Syringe include abatacept and TNF blockers such as adalimumab, certolizumab, etanercept, and infliximab. Be sure to discuss any concerns with your healthcare provider. As always, it's important to follow your doctor's recommendations for the best results. If someone has taken too much Kineret and has severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. This medication is used to treat certain auto-inflammatory conditions and is given as a subcutaneous injection under the skin. The dosage and timing of Kineret injections will be determined by your healthcare professional based on your specific condition. It is important to follow their instructions carefully for the best results. It's important not to share your Kineret medication with others. Your doctor may also need to perform lab tests, like an absolute neutrophil count, while you're using this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you happen to miss a dose of Kineret Syringe, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and continue with your regular dosing schedule. Avoid taking a double dose to make up for the missed one. It's important to stay on track with your prescribed dosage to ensure the medication is effective. Keep Kineret Syringe in the refrigerator, but make sure it doesn't freeze and is away from light. And remember to keep it out of reach of children and pets. When you no longer need Kineret Syringe or it is expired, be sure to dispose of it properly. It's best to consult your pharmacist or local waste disposal company for guidance on how to do this. And remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.